first know what's normal. I have seen people who have endo and don't know it until someone tells them, hey, it's not normal that you're in severe pain and ibuprofen's not working for the first 3 days of your period, that you're calling out of work or you can't get out of bed. Like, those are signs of like severe pain. And not that saying that always equals endometriosis, but what happens in the system with endometriosis is the endometrium is the uterine lining. So we're getting lesions, endometrial lesions, implanting outside of the uterus. So that can happen on the bladder, that can happen on the bowel, that can happen on the ovaries, on the tubes.
I had no idea that it was that like encompassing.
Yeah, so then you're getting more pain and discomfort when you're cycling because you're having this endometrial tissue like cramping outside, and sometimes we will see bladder issues or rectal issues. Sometimes women will have bleeding and coming out with bowel movements if they have endometrial lesions on the colon. So it can be, there's degrees of it, but it can get pretty intense. Unfortunately, we don't always have a great way to tell if that's what's going on until we do exploratory surgery to see if that's for sure what's happening. But if we start talking to people about symptoms, I think we can clue into,
the signs are pointing.
Probably have endometriosis, and then we can work on your liver detox pathways. We can look at your hormones. We can try and help you clear that estrogen. We can do things to bring progesterone up. We can regulate your cycles. We can get you away from anemia. We can give you things that help with the pain piece so the cycles aren't so painful. But similarly to the polyps, sometimes people really do get a lot of symptom relief from having surgery and removing the endometrial lesions. What we don't want to get into is that becoming this yearly way to deal with endo.
Right, for it to just keep coming back.
Yes, because then you're going to get adhesions and scar tissue and a whole bunch of other problems. It's not great to keep having surgery for your liver and your detox pathways also.
So. But all these things that you've given us, if we cleared it all out, start fresh, and then work on all these things that help your estrogen regulate and all that, and your liver, and then it's less, then it may not come back or not come back as severe.
Correct.
Yeah? Okay.